I'm dying. I have AIDS. These words still replay throughout my mind every time I think back on the day my mother built up the strength and courage to finally tell me that she was HIV positive. No words could express the amount of pain, confusion, and anger I felt. I had so many questions: who, how, when, why. She told me that she had contracted it from her boyfriend, whom she was still in a relationship with, and that she had been too embarrassed to tell my siblings and me. She feared that we would not want to eat her cooking or hug her if we had known. This was so devastating to hear. I look back on the years prior to her telling me, and in my heart, I had known all along that something was wrong. She had become a different person over those last few years. She was severely depressed, and she didn't smile as often.
Just to start off, stigma is often a sort of a nebulous term people use a lot but maybe don't know what it means. It was initially made popular by the sociologist Irving Goffman, who wrote this book on stigma and defined stigma as attributes or behaviors that can cause individuals to lose social value. And he talked about stigma as something that's based on an attribute that is deeply discrediting and reduces a person from being seen as or feeling as not being a whole and usual person, but a more of a tainted and discounted one. I kind of like this definition of health-related stigma. It's a social process or related personal experience characterized by exclusion, rejection, blame, or devaluation that results from experience or a reasonable anticipation of an adverse social judgment about a person or a group identified with a particular health problem. Now, one thing I wanted to talk about is that we've been able to sort of tease out some different dimensions or types of stigma. And these are important because they're all very real and they all have effects on health. So the first one is what we call anticipated stigma. So when people actually fear being stigmatized because of their condition or identity, even just anticipating those fears can have effects on health. We also talk about normative stigma or perceptions of community norms, and that's sort of perceptions of stigma out there in the community. So what do you see going on or perceive as going on? How are people like you treated? Another important dimension is experienced or enacted stigma, which also could be referred to as discrimination. And here we're talking about being physically or otherwise actually discriminated against or abused because of your status. And then another really important one is internalized or self-stigma. And that is when people living with the condition kind of internalize those negative attitudes that are out there in the community and start feeling bad about themselves, blaming themselves, having low self-worth because of this stigma. So how can stigma actually affect health? Again, it seems like sort of a soft and nebulous thing, but when we think about it, it actually has some very direct and indirect effects on health. For one, it adversely affects the quality of life and both physical and mental health of people who have the stigmatized conditions. We also know that stigma and fears of stigma make people less likely to practice preventive behaviors and or utilize needed health services. And in some cases, stigma can lead to even discrimination and acts of violence, which also could have adverse effects on health. So here is just a very simplified framework that can maybe help you think about the effects of stigma on health. So we know that stigma has some known psychosocial effects in people: shame, blame, guilt, fear, denial, secrecy. And these in themselves can have negative effects on especially mental health, but they also have behavioral consequences. So if they feel these things, they might not want to disclose their health status. They may delay in seeking care. They may avoid services altogether. They may not want to practice prevention behaviors if it makes it appear that they're in a certain stigmatized group. They may not take their meds. They may experience discrimination and violence. And all these things then have adverse effects on, mental and physical health, and can also result in onward transmission of infections. A lot of qualitative research, a lot of cross-sectional studies have found that HIV-related stigma is associated with poor engagement in HIV care and poor ART adherence. The effects include lower acceptance of HIV testing, lower access to medical care, poor ART adherence, and lower utilization of HIV care once in care. This is a conceptual framework that also just helps us think about how stigma operates. I think the thing to maybe focus on is that stigma works through different pathways. It works through interpersonal factors like disclosure and social support. It also affects psychological researches like self-efficacy, self-esteem. It also affects people's mental health, and its stigma is strongly related to depression in particular. And then it also seems to potentially work through stress processes, so that people who experience a lot of stigma and discrimination have chronic stress, which actually may directly affect their health outcomes. So again, this chronic stress that people are having, chronic and multiple experiences of stigma that may actually directly affect their physical health, and this would work through the stress-responsive biological systems in the body, hypothalamic pituitary adrenal axis, or sympathetic nervous system. And this is an ongoing area of research.
My mother had lost so much weight when I last saw her. I thought that maybe she had cancer, but she denied it. The pain that she must have endured keeping her battle with the illness inside. How hard it must have been to feel so much shame and hurt that she could not confide in her own children about her condition. After my mother disclosed her status to me, I was bound to secrecy. My mom was getting sicker and sicker, yet she did not want me to talk to anyone about it. It was so traumatizing to watch someone I loved so much deteriorate in such a way. My mom passed away in 2013 from AIDS-related illnesses. She was only 41 years old. It took me some time to be comfortable enough to say that someone I loved had HIV, to say that my mom had HIV. No one should have to suffer in silence. We can get through this together.